Hello and welcome. Um, have you gone through the previous lectures? Have you gone through the previous lectures? Yesterday's lectures?
Yes,
Okay, so it will be easier for us to follow up. Open Roberts chapter number 26 today. Chapter number 26. Now, start the first paragraph. Please start reading the first paragraph. You got your book? I think only Komal is there. You got your book?
Yes, sir.
Okay. Please, can you read for us the first paragraph of chapter number 26?
General stigmata. This
Yes.
is classification. Okay, sir.
Hmm.
General stigmata, or as the Hahnemann calls them, mism.
There is a problem. Wait. There is a problem. Wait for a second. I will be right back.
Okay, sir.
Okay. Please go on.
The general stigmata, or as Hahnemann calls them, mism, are fundamentally infection of a specific nature. It is well to bear in mind the basis of all the infection and of all chronic disease before we can properly understand the working of a stigmatic disease. Let us consider syphilis for instance. This is one of the comparatively modern disease, and it is the basis for many constitutional troubles. Syphilis is from its inception a constitutional disturbance. Syphilis is supposed to be contracted from an impure poison. Much of the susceptibility and lowering of the defense towards the specific poison is deployed and maintained because of the mental attitude of the individual in that in its very inception it is a violation of his moral standard and therefore reacts upon and lowers the vitality.
And lowers the vitality. Okay, and this is the problem with your mic system, sound system. Uh, it's echoing my voice and it is coming in the record also. So when you stop reading, just close your mic so that my voice is not echoing back. Uh, this is underline contracted from an impure question. Okay, and mental, the attitude of the individual. Underline this. Violation of the moral standards. Underline this. Okay, that is why people are saying, there are some people who are saying, even if you are using condom, you can prevent the that manifestation at the primary manifestation at the point, but the violation of moral standard is already there. This shows that the disease was already there. This is a bit high level of philosophical understanding of syphilis or psychosis of the venereal diseases or venereal miasm, because even if you are using condom, external barrier to prevent the organism to enter, but you are already diseased because of your mental attitude, you are violating something. Okay, now next.
Let us consider what happened after an impure poison. Prophylactics seemingly have very little to do with preventing the development of this condition, but there remains a period of about 3 weeks after the exposure
Underline this,
when
3
no
weeks.
symptoms.
Next.
No symptoms or manifestations of any
A
kind
bit louder.
appearances. Yes, sir.
A bit louder. We cannot hear you. Cannot hear you. Please read a bit louder.
Okay. Or manifestation of any kind show themselves.
Next.
Should I read, Dr. Etusham?
Oh, yeah. Okay, yes. You can read. Okay.
This is the period when the disease is, I hope it's not echoing now.
No.
Okay. This is the period when the disease is taking hold on the system constitutionally, while apparently producing no symptoms. Then the vital energy undertakes to expel the poison, performing a shankar on some part of the body surface, usually the genital organs. In other words, the vital energy.
Underline Shankar on genital organs. We have read that after the moment of infection, the disease will develop inside and the disease will propelled. Vital force is propelling the disease outside, usually at the site of infection. Okay. For Sora, it was touch. If the Sora was coming from touch and this was the site of infection, the primary manifestation will most probably will occur at this point. Okay, and the syphilis and psychosis are coming from friction and coming from touch of genitals. Okay, so most probably this primary manifestation will occur on the genitals. Clear? Chancre on the genital organs. We are reading about syphilis, development of syphilis. Next.
In other words, the vital energy is attempting to push out the enemy, and so long as this chancre remains on the surface as an expression of the inward turmoil, no constitutional symptoms appear here. This state may
Underline this.
last.
As long as this lasts, no constitutional symptom will occur. After the suppression of it, the constitutional symptoms will start appearing. Okay, and sadly we are getting the constitutional syphilis only nowadays. No frank syphilis patient will come to you, or they are not knowing that they are having the infection of syphilis because of this prevention barrier methods and all the this safe sex methods. Next.
Okay, it means as long as the chancre remains on the surface, then the secondary symptoms of syphilis will not occur in the person, which affect the different body organs or it
Yes,
means,
yes,
right? Okay.
yes.
And then when we'll suppress it by external use, then all the secondary symptoms will develop, right?
Wait, right.
Okay. Thank you. This state may last for months or even years, provided it is not suppressed. In just the degree that this chancre does not suffer, interference does it represent the ability of the vital energy to cope with the intruder. The general treatment among physicians is to cauterize or treat locally this manifestation, such treatment tending to immediately dry the chancre and throw the poison back by suppression into the innermost recesses of the system. Then it is that a chain of symptoms begins to develop, showing that the vital energy is profoundly disturbed and that is helpless to cope unaided with the enemy. Now, investigators in the ordinary school of medicine have begun to question whether chancre is not provision of nature to counteract the syphilitic poison, their theory being that the chancre actually produces within itself antibodies that act defensively against the specific inroads of the disease.
Okay, that was the question a few years back, a few decades actually back. The book was written years ago, but now it is a proven fact that these chancre, people find out that unless that chancre was not cured, that insane palsy, insane paralysis, or other constitutional manifestation of syphilis were not coming. Why it was so? Okay, why it was so? So people started to research and found that this chancre is actually preventing the constitutional symptoms of syphilis to break out. This is a proven fact nowadays. Previously, people research that why it is happening. Okay, nowadays they are not treating it locally. Okay, syphilis is first of all, incident of syphilis is now very less. Next, the frank syphilis, the primary manifestation of syphilis, chancre on the that. Next, even if the chancre they found on the genitals, they are mostly treating with high doses of antibiotic. Okay, not treating it locally. So those constitutional symptoms are also not seen, and you can say it has gone to some deeper level. Still, the people are born with the cleft palate. Still, the children are born with a hole in the heart, with the other congenital defect. All these are the syphilitic taint. And one more thing you will commonly get in your clinic is a viral infection of the genitals. Okay, herpes. Usually genital herpes is a very stubborn disease and will not respond to any sort of treatment. And you can say that this genital herpes is has replaced syphilis. Syphilis is bacteria, and lots of antibiotic have been used, and antibiotic are useless against virus. So these genital herpes, okay, you will get lots of cases in your clinic of genital herpes. Okay, it's look like syphilis, but it is not due to syphilitic bacteria, say organism, spirocat, but it is due to herpes virus, and it is very stubborn to any sort of treatment because it cannot be treated with antibiotic. Okay, and with your medicine also, you be sure that it is a kind of syphilitic taint or a kind of mixed miasmatic disease, not easily treatable even with homeopathy. Next.
Usually, the next step taken by the nature is to produce an eruption on the body. If this manifestation is in turn treated by suppressive measure, the disease attacks the internal organs, tending always to attack that part of the organism that is least able to resist. It may be the
Underline,
central nervous
attack that part, underline which is least able to resist, underline that. Next step, what next step? After suppression of the primary manifestation, nature is to produce an eruption on the body, the syphilitic eruption, any ulcer, any sort of ulcer at any point of body, produce an eruption on the body. Next, it may be central nervous system, attack that part which is least able to resist. Okay, depend upon the tendency and susceptibility of the organism.
It may be the central nervous system, may be the arterial system and the heart, it may be the liver or intestinal tract. Any or all of the tissues of the body feels the deadening influences of the intruder. These manifestations may be suppressed in one place after another so that the man lives out his days with this incubus in his system, ever ready to develop into some new manifestation at the most trivial provocation. Grief, sorrow, and worry are potent influences to develop these manifestations. Or it may be exposure to the elements, a slight accident, stress of business relationship, or any one of many other causes that starts the irritations. But unless this is met by the art of similar antisyphilitic remedy, he passes his days in discomfort and distress and comes to a premature old age.
Okay, underline this, premature old age. This happens in any sort of miasm, in any miasm. Keep suppressing the symptoms the disease is giving, the disease will go inside and inside and inside. There is a concept of Vitholkas levels of health. How many levels of health of Vitholkas are there? There are 12 levels of health. Okay, the 12th level is the least means most worst level. Okay, and the level 1 is good, most means best level of health a man can attain, and each level have been divided into 3 stages. Okay, Vitholkas level of health, what it is telling that wait for a minute. Okay, are you telling something?
No.
Okay, this is telling that this is, see, there are 12 circles here. Okay, when I cannot draw all the 12s here. See, this is suppose the outer layer of the organism. Okay, if the organism is healthy, it will produce the manifestation on the outer layer. Okay, on the outer layer, functional level. Okay, and suppose you have suppressed it. Okay, the disease will further go inside, and again you have suppressed it, the disease will further go at inner level. Again you have suppressed it, disease will go at this level. Okay, so inner man will finally be sick. Okay, this is the level of health. What is in this paragraph, Robert is explaining that disease will attack one after another organ. What I have explained before also, that remove the ovary, diseased ovary, the disease will go to, it is a dynamic journey of disease. You will remove a manifestation and the disease will go to some other important part. Okay, this is like fortress. This is like means defense system. You have ditched a defense system, the next level of defense system will be there, the next level of defense system will be there, and ultimately you will find the king. Okay, and the king is the core, inner of the man, and ultimately at the level 12, the disease will attack the king and you will have the checkmate. Okay, so this is what Kent have told in his chapter Carbovage. Open Kent's chapter Carbovage and I will show you a line from Kent. Carbovage. There is a line where Kent is telling the man should not worn out. Okay, it can be decay with time. The body can decay with time, but it should not worn out. Okay, and by your treatment, the man is warning out. Premature old age. This is another book. I have not underlined it, so it is difficult to find here. If you find that premature old age, the man should worn out. Should not worn out. A whole paragraph is there. If you find, tell me. Okay, I'm not getting it. I will tell you it. I will tell you later. But it is in the chapter of Carbovage. There is a, I think there is a paragraph where Kent is telling that all these are actually what it is doing. It is actually warning out. Warning out means the man should not warn out. It can decay with time. The body frame can decay with time, but it should not worn out. By these treatment, sending disease to inner and suppressing each manifestation after another, we are warning out the body. Okay, premature old age. Next.
This stigma has its effect upon the protozoon, and the offspring shows the effect in many ways. When the offspring is affected with the syphilitic taint, he will not show the direct effect in the primary chancre or ulcer, for by the time the
Underline
disease
this.
has come.
Underline this sentence. When the offspring is affected with syphilitic taint, underline.
Chancre or ulcer, by the time disease has passed into the second generation, the fault has become thoroughly married to the life forces and it becomes a part of his being. This results in many constitutional tendencies such as deformity, chronic cattle conditions of the nose and throat, malformation of the teeth
Underline
and
on
of the.
these. Underline on these. We think that general allergic rhinitis are very easy disease, and during treatment you will find that it is not easy. allergic rhinitis. What it is calling chronic catarrhal conditions. Chronic catarrhal conditions. Okay, of the nose, ear, throat, and what are the sphere of action for syphilis? Larynx, trachea. Okay, the auditory canals. These are the sphere of action for syphilis. Brain to hai, spinal cord, brain, and this eyes and bones. All these are there, and the ENT portion is also our sphere of action for syphilis. So this allergic, why these kind of allergic rhinitis are difficult to cure? Because of their miasmatic nature.
Tendencies such as deformities, chronic catarrhal conditions of the nose and throat, malformation of teeth of the bony structures, ulcer, and many other manifestations. In the second generations, we find none of the primary local manifestations, but the manifestations have changed their character, showing that the economy is thoroughly impregnant with the deadening and destructive effect of the stigma. In the
Okay.
primary
This, mercurius, in mercurius, you will find lots of teeth symptom, decaying. Okay, early decay or decaying in the sockets even before the eruption is complete. In creosote, you will find. So all this indicating the syphilitic base of these medicines. And other malformation of teeth are what? Hutchinson's teeth you will get. Okay.
congenital
Uh, huh. What you're
cupping
telling?
teeth in congenital syphilis,
Huh.
they are getting Hutchinson.
Yes, Hutchinson's teeth, and there are teeth
Retinal
irregular.
depigmentation,
Yes, yes,
irregular alignment,
irregular alignment. Okay, there are no regular alignment of the teeth, irregular teeth, or
cleft palate,
cleft palate. The malformation of teeth, वो तो है ही. Palate का disorder तो है ही. Plus malformation of teeth, you will find the teeth are
gapping,
bulging out.
gapping. Yeah, gapping between the two teeth, excessive gapping, and
Yes,
shortened teeth means dwarf
yes.
teeth.
Yes, all type of malformation of teeth.
Serrated.
Okay, one teeth is present and other is coming out. This is also syphilitic. You will find in clinic, I have find this in clinic, the gum boil was there, recurrent gum boil is there. I order a x-ray for that teeth and found that one teeth is present already and next teeth is coming out. So it is forming a recurrent gum boil. It is coming. So what was the treatment? Just remove the deciduous teeth and give the space to upcoming teeth. Okay, so these all type of malformation of teeth you will get in your clinic. Okay, think of syphilitic base for these patients. Next.
What is miasm behind the impacted molar teeth? If somebody have impacted molar teeth,
You can say there is not enough space. No, not enough space for the molar
to erupt.
erupt. And it can be easily called a syphilitic miasm. If there is congenital absence of space and there is tooth in the socket, okay, this is syphilitic. But most often what happened that it is the last part. No, it is the last teeth to erupt and at the last part. So most often there is enough space, but there is some difficulty with eruption. There are some medicines which are helping me very much in this sort of difficulties when there is a space, but teeth is irregular, bented, or just not coming out straight. There are a bunch of medicine which is helping me. Like,
cherry
name some medicine. Cherry cherry,
Mactar,
Macab, Hecla lava. Okay. And, yes, Hecla lava and Cherryanthus cherry. Lead them all. Cherryanthus cherry, lead them all. In some constitutional trouble. Yes.
Cherryanthus cherry's result is in potency or in
30. 30.
Okay.
It is working in 30. Macab. Macab, when the constitutional element is there for prescription of Macab. But when there is no constitutional element, you can prescribe Cherianthus cherry specifically, means what you call empirically. Next.
In the primary disturbance, we may find that if this infection of syphilis become grafted onto a soric base, here we have a complications of trouble. And just as each of these stigmata is problem in itself, the union of the two becomes a much more complicated problem, requiring great patience and skill to solve. Usually, in this union of psora and syphilis, the soric symptoms predominate, and here the predominant symptoms of psora must be treated first with antisoric similimum, for the syphilis is largely hidden, and we must strive to help the vital force to throw off the greater and more predominant incubus which the patient manifests.
Same type of thing Hahnemann have told at one place in Organon of Medicine during intermittent fever, treatment of intermittent fever. Same type of thing. Aphorism number 232. Go to aphorism number 232. Alternating disease developed by psora alone, sometimes but seldom complicated with the syphilitic miasm, and therefore in the former case may be cured by antisoric medicine, in the later however alternation with antisyphilitic medicine. So whenever there is psora and syphilis, you have to treat in this fashion. Hahnemann have given example only in intermittent fever, but there are many other diseases where this psora and syphilis and they are complicating each other, and this is most oftenly and most famously called as tubercular state or tubercular diathesis. We have discussed it a lot, that tubercular diathesis, according to Robert and other stalwarts, it is psora and syphilis, but according to J.H. Allen, it may be psora and psychosis also. Next.
Uh, after the patient After the patient responds to the remedy by decided improvement in the conditions first prescribed for, change our soric condition is largely obliterated. We must change our tactics, for then the syphilitic dysplasia will show itself and become prominent. Then the symptoms must be met with an antisyphilitic stimulum or the remedy that is most similar and adapt to syphilitic symptoms, to which we will be guided by a similitude of the remedy.
This
The
is what
patient
change of plan of treatment. This is change of plan of treatment. Okay. Go to Kent. Go to Kent's philosophy. Uh, this last para of second prescription. Second last para. The second prescription also takes in consideration of the change of plan of treatment. Kent's philosophy, page number 241. Second last para. Second prescription.
Sorry, I'm not getting the book. Okay, got it. Page number
241.
240.
In my book, it is 241.
Okay. From where?
The second prescription also takes into consideration.
Okay. The second prescription also takes into consideration the change of plan of treatment. The plan of treatment consists in assuming that the case is a soric one if looming up before the eyes all the symptoms in the case and this history indicates psora. The treatment has probably consisted of sulfur, graphitis, and such medicines as are well known to be antisoric. The symptoms have run to these remedies, but behold, after you have made the patient wonderfully well, and you have effected marked change in his systems, so that the soric symptoms have disappeared, and he comes into your office with ulcerated sore throat, with dreadful head pains, with the constitutional state, and appearance that will lead you to say, "My dear sir, did you ever have syphilis? Yes, 20 to 30 years ago, and it was cured with mercury." Now, the sodic conditions has been subdued and this old syphilitic conditions has come up. This then indicates the second prescription. You have to adjust your remedies to an entirely new state of things. So it is also with regard to psychosis. These states may alternate with each other. When one is uppermost, the other is spoiled. So you have to change your plan of treatment according to the state of the patient.
Okay, this is the change of plan of treatment. According to predominant miasm, you are using your medicine, is it not? According to predominant miasm, all of a sudden the patient appears with a sore throat and dreadful pain is there, and you know that this sore throat, dreadful sore throat, what we call in old literature is syphilitic angina. Have you heard this term, syphilitic angina?
Yes, yes.
Where?
In medicine.
In hydrastis. Allen's keynote, hydrastis. Go to Allen's keynote, hydrastis, last line, syphilitic angina. What is this actually? This is sore throat, dreadful sore throat, severe sore throat. Old term for sore throat. Okay, means dreadful sore throat. And we know that syphilitic is affecting larynx, trachea, auditory canals. All these are the sphere of action for syphilis. So that is a side topic for discussion, that all of a sudden sore throat appear and you know that psoric base have subsided and syphilitic have come up, and according to that you have to change your plan of treatment. Okay, what Hahnemann have said in 232 aphorism number with example of alternating disease, what Robert have said, what Kent have said. Okay, according to predominant miasm, you started the treatment with a predominant miasm, they subsided, the base is subsided, next base is coming, next layer is coming. So start with antisoric. When you are in confusion, always start with antisoric, and treatment always ends naturally with antisoric. You don't know that whether you are going to finish this treatment in this generation or not, but at the end, I don't know, I have not ended any treatment for chronic disease, but it would end with antisoric, as people used to say. Next.
The patient who is suffering from syphilis in the latent state or who manifests the inherited stigma presents a picture that is very easy to recognize, and
Understand this, very easy to recognize.
this is
And
probably
next,
the easiest.
probably easiest miasm stigmata to treat. Underline this. Why it is easier to recognize? You will get some congenital defect. You will get the dissimilar faces. You will get the parallel cracks. You will get the cracks on the tongue, or most probably the parallel cracks on the tongue. You will get the high arched palate. So these are all indicating syphilitic taint. So it is easier to recognize. Other symptoms Robert is giving.
Patient
Okay.
with inherited or latent syphilis are mentally dull, heavy, stupid, and especially stubborn, sullen, morose, and usually suspicious. They are always depressed, but in the depressions they keep their troubles to themselves and sulk over them. These are the people who develop fixed ideas which are not eradicated by any amount of explanations or talk. Their mental power are slow in reactions. They become melancholy and condemn themselves. They like to be alone, yet desire to escape from themselves as well as from others. In their slowness of comprehension, the thoughts they had in starting a sentence will vanish. They forget that they were about to say, and they find it hard to get back into the track of their conversation. If they are reading, they read a few lines and then they must reread it to comprehend it.
These are the latent, means these are the mental symptom of syphilis. So, so near to psychosis. Some symptoms of these are more predominant in psychosis, and some symptoms of psychosis are more predominantly present in syphilis. Next.
So here how we can differentiate the fixed ideas and the suspicious
You will be
nature
able to
of the
differentiate it. You will be able to differentiate it when we read the fixed ideas of psychosis. Okay.
uh, they are always worse at night. All the symptoms develop more after the sun goes down. There is oppression, restlessness, and anxiety at night. They dread to the night because it is so oppressive. Restlessness is so great that it drives them out of bed. We must remember that the tuberculosis
Aggravation. This is marked aggravation of syphilinum also. Go to syphilinum and you will see that at night, from twilight to daylight, all symptoms are worse at night. And it is not only worse at night, it goes with rhythm of the night. जैसे जैसे रात बढ़ती है कंप्लेन बढ़ता है, जैसे जैसे रात ढलना शुरू होती है कंप्लेन भी खत्म होना शुरू होता है. So this is the rhythm of night which syphilis usually follow. You can write in the margin rhythm of the night. Next.
we must remember that the tubercular patient is manifesting the union of syphilitic and the sodic dysplasias. Oftentimes, we find the child who has inherited this stigmatic combination has a tendency towards tuberculosis. This child presents the picture of the problem child. In his school, thin flow of comprehension, dull, unable to keep a line of thought, is unsocial, keeps to himself and becomes morose and sullen. No greater service can be rendered to the society than to meet these conditions of the problem child of school age and under with the homeopathic treatment, using as a weapons the antiseptic and antisodic remedies as they are indicated. This is the only treatment that will put these children into the sphere where they will be able to develop normally and become useful, happy citizens.
Now
In
underline this
patients,
problem child. Okay. Underline this problem child, and we have till now studied that tubercular children are intelligent. Okay, are restless. But this Robert is giving a totally different picture of tubercular child when the syphilis miasm is predominantly present. Okay, suppose uh, this is organism 50-50. Okay, 50% Sora, 50% syphilis. Okay, this is syphilis, this is Sora. Okay, if this miasm is predominating, if Sora is predominating, okay, the child will be intelligent. If it is predominating, going this is, okay, the child will be intelligent. But if this syphilis is predominating, the child will be of, sorry, if the syphilis is predominating, child will be of problem child. What Robert is telling. So don't confuse with the idea that we have heard tubercular are intelligent. Which kind of tubercular will be intelligent? In which these Sora is predominant. Okay. If the syphilis is predominant, the child will be what Robert have told you, the problem child, slow in comprehension. And this happened also with the psychosora. Okay, same thing will happen in a different degree. Next. And the confusion part, okay, confusion part is totally of psychosis. You will get a confusion. Next.
in patients manifesting the syphilitic stigma, if we are so fortunate as to observe the appearance of external manifestation or unusual discharge, we will observe also that the patient is greatly improved in general and his mental state will seemingly become more normal. And this is true if a catral and liquorial discharge is established. It is if an old ulcer, perhaps of the leg, open up and discharge. And so long as these avenues of escape are active and patients will be more normal. However, the nature avenues of elimination do not ameliorate the patient. Sweating aggravates rather than ameliorates, and natural sweat, profuse urination, and diarrhea never ameliorate the syphilitic condition. except in constitutions such as tubercular, which are
Underline
combination of
these also. Natural avenues of elimination do not ameliorate the patient. Natural avenues of elimination ameliorate which patient? Psoric patient, and to
sorry,
some extent tubercular patient. Okay, mainly psoric patient are ameliorated, and tubercular patient, those who are predominantly psoric, will be ameliorated. But syphilis will be aggravated. Okay, syphilis will be aggravated, and psychosis and syphilis will be ameliorated by abnormal discharges. Abnormal discharges will ameliorate psychosis and syphilis, and normal discharge will aggravate syphilis. Okay, normal discharge will aggravate syphilis. Next.
sweating aggravates rather than ameliorates. The natural sweat, profuse urination, and diarrhea never ameliorate the syphilitic condition, except in constitutions such as tubercular, which are combinations of the syphilitic and psoric. And this is due to the general ameliorations of all psoric manifestation from these natural avenues of elimination. In tubercular children, a hemorrhage from the nose will clear up the mental state of the sometime for some time, and tubercular adults, nosebleeds will clear up whole measles. Now,
Now,
the degenerate
why this is in tubercular? You are finding this because of syphilitic parentage. Okay.
Now the degenerates and criminals are criminally insane are either psychotic or syphilitic in their stigmatic inheritance. Many are criminally insane and degenerate could be very greatly benefited and probably cured by some of antisyphilitic chemicals. Let us take up
Underline
some
this.
of
Criminals and criminally insane. These are psychotic and syphilitic. I have told you a case of one of the Mostan previously that I have treated him with ignitia initially, and then finally given him anti-syphilitic medicine at last. Okay, and he was so much reformed of his occupation, of his profession. This was the case of NIH OPD, that the patient came to me with a this much tennis ball like tumor, and I started with ignitia due to sudden grief in the history, and finally the patient needed the antisyphilitic medicine. Okay, so this idea came to me to give him antisyphilitic medicine from this book only.
let us take up some of symptoms of the head as manifest in the syphilitic patient. These headaches usually come on in the night and are almost always in back of the head. They will ache all night, get better in the morning, only to come on again at night. The headaches are dull, heavy, yet lengthening. They are persistently constant at the base of the brain or on one side.
What is the base of the brain? This back of the brain, base of the brain. Okay, base of the brain. You know that part, bones and medulla oblongata. Huh? That is the base of the brain. So that part, and the sora headache is always frontal or sides. Okay, a syphilitic headache, syphilitic, even the syphilitic vertigo will be the base of the brain. Note the modalities. Okay, the always at night. Next.
Uh, the headaches that come on Sunday or when they are away from their usual vocation are usually story and syphilitic combination. Syphilitic headaches are usually aggravated by riding, ameliorated by motion, aggravated by exertion, and either mental or physical. They are usually accompanied by a great deal of coldness of the body, sadness, and frustration. They are aggravated by warmth or heat, and ameliorated by cold application, aggravated by quiet rest, while lying down at night and by sleep, and ameliorated by no sleep. Note the indications for the syphilitic headache as being almost exactly opposite those of the sodic type,
Underline this.
which
If you remember one, you can tell the other. Exact opposite to the psoric type. Okay, read next paragraph.
often times the syphilitic patients complains of a band about the head, which is probably due to slight effusion from the meningeal surface. A child with this syphilitic headache will bore his head into the pillow or roll the head from side to side. Without the
You know some
antisyphilitic
medicine
remedy,
for rolling the head from side to side?
yes, Helleborus,
Yes,
tuberculinum,
Helleborus, tuberculinum. Rolling the head on the pillow. So why there is rolling the head on the pillow? There may be slight effusion. There is meningeal disturbance, meningeal irritation. For that, so meningeal irritation, the sphere of action for syphilis is meninges. You know, so there is meningeus affection, meningeal affection, and there you get this symptom. So you are connecting the symptom with the pathology. Okay, but it is not always true that you will get a pathology for a symptom. Okay, if you are getting a symptom for a pathology, it's okay. Okay, but it is not always that you will get a symptom, a pathology for a symptom. So this the band around the head is also, Robert is telling that there is a pathology, slight meningeal effusion. If there is no pathology, then it will fall under what? Subjective symptom of SORA. Okay, if there is no pathology, then it will fall under SORA. If there is pathology, it will fall under syphilis.
without the antisyphilitic remedy, these headaches are not easily amenable to treatment. Some people complain that before these headaches, they experience a ravenous hunger. These manifestations are combination of syphilis and SORA.
This ravenous hunger is manifestation of. Next,
The syphilitic stigma shows many types of vertigo, but especially those at base of the brain. These
underline this.
may
You
be
will get patient. My डॉक्टर साहब चक्कर यहाँ से स्टार्ट होता है, हमको लगता है यहाँ से हो रहा है चक्कर. From this side, from this part. Okay, you will get patient and think of the antisyphilitic medicine. Though SORA has prominent vertigo symptoms, but if there is vertigo due to degeneration of the spine, you will get vertigo in spondylitis. Okay, cervical spondylitis or spondylosis, you will get vertigo. Degenerative disc disease of the cervical spine, you will get vertigo, and all these vertigo is basically the syphilitic origin. Okay, though vertigo is most prominent symptom of SORA. Okay, but soric vertigo will complain of just vertigo from here and there and puro matha gulche like that, but the syphilitic vertigo will point out that, and even if it is not pointing out, he is not pointing out, you will get some pathology in the base of the brain or nape of the neck. Okay, so calcarea floor in degenerative disc disease having vertigo, I use generally calcarea floor. Okay, any other medicine may be used, but this fluoric acid and calcarea, I think this syphilitic element of that calcarea floor is helping me in such kind of vertigo. Out of I think 10, out of 8 out of 10 patient, these kind of vertigo have went with calcarea floor 6 in fractional doses. Okay, because of this concept only. Why I'm telling you this? Why the knowledge of miasm is important and how you are correlating. Why calcarea floor are working on the bones or the spines. Okay, because of the syphilitic element of it. We know the pathology. If you read the calcarea floor in your Materia Medica book, you will read, get the affections of bone because of this syphilitic. Fluoric acid is a syphilitic medicine. Okay, so from that I correlated and started using calcarea floor in such kind of vertigo due to degenerative disc disease. Okay, and it is giving me result. So 8 out of 10 cases were relieved with this treatment, calcarea for 6 or 30 in fractional doses. So this knowledge of miasm is helping you to find out your remedy. Next.
Uh, these may be present also in psychotic stigmas, but they are especially apt to be present in the tubercular diaphysis. The combination of syphilis and SORA, since both syphilis and SORA have marked vertigo, the union of two
Underline
stresses,
this also.
this symptom is a marked vertigo. The symptoms of high blood pressure is caused from the structural point of view by a thickening of the arterial cord or an attack of the nephritic obstruction. are in the expression of an actual change of the structures in this arterial system. Change of structure does not occur in uncomplicated soda, but when the sodic dysphagia is combined with the syphilitic, structural changes do take place, and this manifestation we have an expressions of combinations of these two stigmas.
So it can happen in psychosis also. Deposition of the arterial, thickening of the arterial cord can happen in the psychosis also. So underline thickening of the arterial cord, high blood pressure, thickening of the arterial cord, or attack of nephritic obstruction. Okay, nephritic obstruction,
The
high
appearance
blood
of
pressure.
people
Next.
The appearance of the people suffering from the syphilitic stigma often tells the story of a glance. At a glance, for we observe that the head is large and bulging. The hair is moist, gluey, greasy, and with offensive odor. The hair falls out in bunches, beginning first on the vertex, then on the temples. The hair on the eyebrows and eyelashes falls, and the hair in the beard falls. The hair in the beard are often ingrowing and separate. Elderly people often complain that the hairs in the eyelashes split and turn inward, causing much irritation in the conjunctiva.
Okay,
Closer
this is
exam
the ingrowing eyebrows. You must have seen in your clinic these ingrowing eyebrows are also syphilitic. Hair falling out in bunches. You are getting a alopecia, sort of alopecia on the vertex. Alopecia anywhere is not psoric but syphilitic or maybe psychotic sometime. And you will get the pattern of baldness. Some people are completely bald. Okay, some people are completely bald and some people are bald at vertex, only vertex, and hairs are hair hairs are present, all these line just vertex, there is no hair like Hanneman. Okay, so this is the pattern of baldness may help, but I'm not sure about it that it is means calling you to a definite miasm may help to see that what kind of miasm it may be. Next.
Closer examination shows that in these greatly enlarged heads the suture are soft. The fontanelles remain open after the normal time of closing, and there is a general hydrocephalite appearance of the head. The scalp is moist in general. The scalp perspire and hair becomes wet. The scalp perspire when they are asleep or when they are awake.
What was the
The
hair of
eruption
Sora? What was the hair of Sora?
dry, lustreless, excessive dryness with
Tangling,
dandruff,
not easy to comb,
tidy, not
dry.
tidy.
Yes, yes. So it is exactly opposite here in syphilis. Moist hair because of excessive perspiration. Next.
Uh, Eruptions on the scalp are almost moist with thick yellow pus, with under thick yellow pus oozes. The eczemas about the behind the ear having two thick pus and the cracks about the ears and its oral canal have a grafting or syphilitic stigma onto the sodium. In the tubercular patients, the eruptions on the scalp are aggravated by barking.
So underline this eczema behind the ear. You will get patient eczema with this peculiar kind of eczema behind the ear and means affecting the oral canal and ear. All these are the grafting of syphilis on sora. And I have told you in skin diseases with a syphilitic base, sorinum is wonderfully working for me because of one of my senior have informed me that sorinum has a syphilitic base. Okay, so rhinum is in a patient of skin disease with a syphilitic base. So rhinum will work because of its syphilitic tint. Okay, and we have discussed a case yesterday also that whenever there is a skin disease in a syphilitic patient, you can think of sorinum.
The eyes are astigmatic and this
What were the
syphilitic
eyes of Sora? What were the eye symptoms of Sora? All the functional symptoms.
yes, flickering and
Yes.
all
Uh,
the
Oversensitiveness, yeah,
light, yes.
yes. All the functional symptoms, oversensitiveness and like that. But here there will be structural changes you will getting. Read.
The eyes are astigmatic, and this differential dysphasia has deformities of the lens and of the cornea, and all refractive changes are related to the astigmatism. Remember that syphilis deforms everything. Sora alone and by
Underline
itself
this.
never.
Underline this. Syphilis deform everything.
Sora itself never caused these deformities, but in the combinations of two we find great many deformities. Ulcerations
Next.
is the hallmark mark of the syphilis. You will find in these patients ulceration of the cornea, ulceration of the lips. A peculiar reaction of these patients is that they are intolerant of artificial light. You'll hear them say that they cannot read or work by artificial light. This corresponds with the period of aggravation and symptomatic ptosis of the
Okay.
lips and neuralgia of
पीरियड
the
ऑफ
eye.
एग्रीवेशन मतलब यहाँ पे बोले बगैर बोल दिया कि नाइट में ही तो आर्टिफिशियल लाइट यूज होता है. Okay, this corresponds to the period of aggravation of the syphilitic. Usually in night the artificial light are used usually. So this artificial light are intolerant to syphilis. Ulceration is mark of syphilitic. Underline this. Ptosis and the lids and the neuralgias of the eyes and the head come under syphilitic group. Underline this also. These neuralgia aggravated at night, aggravated by heat. Next.
Vistas from the eyes in these conditions are greenish and greenish yellow in color. This is also present in psychotic people or in people with tubercular troubles. Granulations of the lips as well as size are of tubercular type. In babies and children and young people under 20 years of the age, you often find very widely dilated pupils. These is the indications of tubercular diathesis.
Underline this. Widely dilated pupil. Widely dilated pupil is the indication of tubercular diathesis. Underline this. The pupil is not reacting to light. Is the indication of tubercular diathesis and predominantly syphilitic trend. You will get people. Okay, name a medicine which has widely dilated pupil.
Stramonium,
Huh? Stramonium. Pinpoint
belladonna,
people.
stramonium, aconite,
Pinpoint people. Aconite.
aconite,
Opium.
opium,
Opium
I
is
think,
dilated.
on
Dilated people, no? Opium have dilated people, widely dilated people. In opium poisoning, what you get?
no, I don't know why I remember constrictive.
Constricted people, not reactive to light. It is actually one of the symptom of opium that people not reacting to light. Constricted pinpoint people in opium.
Constricted or
Widely
dilated?
dilated. Constricted, no? Constricted people.
Opium, no.
Huh.
In opium.
Check it once in your check it once in your forensic book poisoning, and you will get constricted people. I think most probably.
Yeah, I also remember constricted.
Yes. So that was the people. Actually, widely dilated people may be the this indication for a syphilitic or tubercular base, but it is when this widely dilated people happen. Then, in cases of fear, you will get a chronic fear in the patient that relates to accessory circumstances. When you will get a chronic fear in the patient, you will get this sort of eye. Okay. Also, that not indicates a particular miasm. Next paragraph. I think we have no time left for next discussion. We will be discussing it next day.
Opium is
Okay.
opium is constrict. Hello.
Yes. Opium is,
Opium is constricted,
yes, constricted people.
and belladonna
Opium
and datura is all dilated.
dilated. Okay, so it may be due to poisoning, it may be due to fear, and it may be due to this miasm, the pathological. Okay, so you have to differentiate whether it is due to this pupil condition. Pupillary reflex we don't often see in our clinic, but in some cases I used to see the pupil reaction of the reaction of the pupil to the light, and whether it is dilated in dilated condition or in constricted condition. Dilated condition shows excessive emotion, excessive joy, excessive fear, and constricted condition shows whether if it is constricted, it shows something else, but it should be normally reacting to the light. Okay, it should be normally reacting to the light. If it is not reacting to the light, it is pathological. Widely dilated pupil is the indication for a tubercular diathesis with predominant syphilis. Okay, any question you are having?
No.
Any question you are having?
No.
Okay, thank you. Thank you for giving your time and attention for 1 hour. We will meet on Monday.